When kids come to Essentia Health-St. Mary's Medical Center after an accident, their first stop is the emergency room. ER manager John Jordan shows us how the hospital has created a special place for kids to receive emergency care.
We're at the Rathke-Bachhuber Children's Emergency Department at St. Mary's Medical Center, Essentia Health. This area was redesigned several years ago to make it a little less hospital looking, a little less sterile looking, and a little more kid friendly. We have sometimes a flurry of activity if there's a critical patient that needs to be cared for. Some of that can be threatening and frightening to children. So we like to try to separate them from some of that hubbub, put them in this corridor, which is in a kind of a back corner of the emergency department, and bring them in through a different direction so that they're not exposed to all those things. Because we know that if we can start them out feeling a little more comfortable, then their experience here will be better. We'll go next to look at one of the patient care rooms that was designed especially for children. Okay. This is room 24, one of several rooms in the emergency department that's set up for kids. If we have a small child, an infant, we might replace the regular stretcher with this crib. Another way to make it a little more safe, a little more friendly for children. And then in the room, you'll notice that we have a little more color here. We have patterns on the floor and on the ceiling. I've heard kids come down the hall with their parents and say, "Do you see the stars?" and "Don't step on the line," and all. They play little games like that, and it just makes it less threatening for kids. We have televisions in all of our rooms, and the kids especially enjoy that part as well. Of course, if we're going to care for kids, we have to have kid-size gowns in all sorts of sizes, blood pressure cuffs, oxygen masks, all those kinds of things. We have a workstation here where some of the nurses and mid-levels and others will work that are caring for kids in this corridor as well. Puts them a little closer to the patient's rooms and makes it easier to pop in and out of rooms. This waiting room would be used if perhaps the rooms were all full and a patient couldn't get into a room right away, or if that patient came with brothers and sisters and family in tow, and they needed a place to wait and for kids to play and be comfortable while the patient was being seen. There are some toys here, there's some books, there's some video games, and a gate so that kids can run and romp and play and be in a safe place. We're hoping that the architecture and the services that we provide, of course, will make the children's experience here and their families' experience here as positive as it can be under the circumstances. It's never anybody's desire to come to the emergency department, but we hope that we can make it a little bit less threatening, a little more kid-friendly, and a little more comfortable so that they won't be afraid to come back and see us again if they have to.
The Children's Emergency Department was named in honor of two deceased St. Mary's emergency room physicians who were known for their love of kids. Thank you for joining us for a final edition of Healthy Living brought to you by Essentia Health. Be sure to catch this episode or past shows online at Essentia's YouTube channel. That's youtube.com/Essentia Health. Thanks for watching and take care.
Healthy Living is brought to you by the experts at Essentia Health. Welcome to the Essentia Health Medical Report.
Almost everyone experiences back pain. That's why Essentia Health has a comprehensive spine care program with an exercise component that's unique in the Northland. Here's occupational medicine specialist Dr. Brian Konowalchuk.
We teach people how to use their back again. I think that's the best way to look at it. So often when we injure our backs or we have years of back pain, we forget how to use our backs properly and we lose proper muscle mass, and psychologically we lose the drive and ability to exercise ourselves appropriately.
The 8-week program includes the use of high-tech equipment designed to strengthen and recondition the back.
We see people post-operatively, we see people before they have to have an operation to avoid it, and we see just people who have chronic back pain and want to improve, as well as high-level athletes. The tools available can treat people from all walks of life.
Patients can call the spine exercise program directly or get a referral from their doctor. I'm Kim Kaiser for the Essentia Health Medical Report.